Mental health is not a destination, but a process. It's about how you drive and not where you're going. Hello everyone, I'm Chandini Ramu, an esteemed member of Daisy K Zambia. In this video, I'll be talking to you about general mental health and myths. So what is mental health? According to WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health is more than just an absence of mental disorders. There is no health without mental health. Let us now look at some quick facts about mental health. Around 1 in 5 of the world's children and adolescents have a mental disorder. Did you know that about half of mental disorders begin before the age of 14? People with severe mental disorders die 10 to 20 years earlier than the general population. Did you know that the global economy loses about $1 trillion per year in productivity due to depression and anxiety? 1 in 10 young people experienced a period of major depression. Common signs of mental health issues include extreme mood swings, changes in eating habits, excessive worrying or fear, problems concentrating, and avoiding friends or social activities. Did you know that more than 1 in 4 adults living with serious mental illnesses also struggle with substance abuse? Having said that, let us look at the causes of mental illness. The cause of mental illness is not certain. However, the influence can be characterized as genetic and environmental. Genetic includes having a family history, and environmental can include alcohol and drug use. Now let us look at some risk factors associated with mental illnesses. There are some factors that increase the likelihood of developing a mental illness. Some of these factors include having a family history, stressed life situations such as the death of a loved one, divorce or financial problems, having a chronic medical condition, use of alcohol or recreational drugs, and a history of childhood abuse and neglect. Now let us look at the treatment. If one feels that they have a mental illness, then one should consult a psychiatrist. It is not advisable to take self-medication or go to a traditional healer. The likely treatment that is going to be prescribed to someone with a mental illness may be medication, which includes prescription drugs that help manage symptoms, psychotherapy, which involves regular interactions with the patient to change behavior and thinking, and changes in lifestyle such as doing some exercise. Let us look at some myths around mental health. Children don't experience mental health problems. This is not true. People with mental health problems are violent and unpredictable. There is no hope for people with mental health problems. This is a myth, as there are treatment options available. Bewitchment is a leading cause of mental illness. This is very false. Having a good appetite means an absence of mental disorders. Mental health problems are rare. All neat freaks have OCD. Alcohol helps cure mental illness. This is a very false notion. Mental illness is a curse. This is very false. In conclusion, mental illness is an illness like any other disease and should be dealt in such a manner. As Daisy K Zambia, we believe in fighting mental illness and not those with mental illness. Thank you.